Hello everyone, my name is Pooja and I have done my Masters in Medical Microbiology. From the past 1.5 years, I have been associated with MyAussieTutor and helping students with providing online tutoring services. So today we'll be discussing a very interesting topic, which is contemporary family therapy. So what all are the learning outcomes we'll discuss in this slide. Firstly, we'll discuss what all are the ethical values and how ethics in family therapy plays a very important role. And what does a structured family therapy, which is a very important part of contemporary therapy, means, and followed by strategic family therapy, and what all are the advantages of structural as well as strategic family therapy. And we'll also gain a deeper understanding about the two different aspects of family therapy based on structural as well as strategic family therapy. So moving to the next slide, we'll discuss what does this contemporary therapy means and how it provides support to the well-being of the whole family. Any type of therapy that covers a full family but not a single individual of the family can be considered a contemporary family therapy. Various cultural approaches play a very important role while delivering contemporary family therapy to the families. This contemporary therapy will provide care without discriminating the clients on the basis of their caste, color, or creed. It means the therapy will be provided in a culturally competent way where every client will be respected and will provided with the services without being discriminated them on the basis of their caste or creed. And lastly, the ethical significance of the approach of family therapy is based on increasing the interpersonal relationship between the family members, because most of the families who are facing issues in terms of interpersonal communication or interpersonal communication gaps, or as well as the conflict between the family or the husband or wife. So all these factors and all the therapists will aim to deliver a care so that the interpersonal conflict between the family members will be minimized and the overall well-being of the family will be improved. So moving to the next slide, we'll discuss how ethics play a role in family therapy. As we know that the main objective of family therapy is to address the emotional, psychological, and behavior issues. It will not only act on the physical aspects of the person, but will also ensure a safe and correct environment for the patients or the clients where they can live freely without admitting the conflicts between the family members. As we know that the Aboriginal communities are more vulnerable to family violence because of the mental issues, or we can say the intergenerational trauma that is existing and increasing the psychological health burden among the population. And thereby the conflicts most often occur among the Aboriginal population, and there is a need to shift the focus of the therapies towards a socially marginalized population like the Aboriginal. The people belonging to this community have more specific cultural needs as compared to non-Aboriginal population, because they are more culturally sensitive and resilient, and therefore providing any type of therapy, for example contemporary therapy, should make sure that all the therapies are provided and the communication is being done with the clients in a culturally competent manner to ensure their long-term engagement. So providing a culturally competent therapy to the Aboriginal population is an ethical part of the nurse or the therapist, where the ethics will be justified on the basis of autonomy, which says that the client has the right to take his own health decisions, beneficence, where the therapist will not provide or cause any harm to the clients, and justice, where all the resources will be provided to the clients whether they belong from Aboriginal community or not, and all the services will be delivered in a culturally competent manner without any discrimination based on their disability or caste or creed. It will ensure increased family outcomes and overall well-being of the family members. So ethics play a very important role, and therapists must ensure the justification of all the ethics, including justice, beneficence, and autonomy for the overall health outcomes of the family. So moving to the next slide, we'll discuss what does exactly structural family therapy approach means. The structured approach of family therapy will indeed focus on adolescents and the rest of the family members. They will also focus on addressing interpersonal conflicts to advance the whole family relationships. The family issues like a maladaptive reaction to changing demands, loss of family structure, and inability to express their feelings and retain information. These all issues will be considered by the structural family therapy approach, and all this will be resolved based on the cultural competent therapy which will be delivered by the therapist. The structural therapy also works on these issues by first engaging themselves with the family, by ensuring a safe and effective communication with the family members, and to develop a safe and rapport with the family members, because a safe relationship with the family members is an essential part of initiating a strong therapist and the client relationships, where and in this way all the patient needs and preferences will be understood by the therapist, and later the therapy will be provided in a safe manner as required by the clients. It is a way to respect their autonomy and also respect their ideas, views, and values. So moving to the next slide, structural family therapy will work on families impacted by trauma, for example, the Aboriginal community, the blended families, the single parent families as well, the intergenerational families, and even the divorcees and the children, because in divorcees the children are most affected and they are often experiencing neglect, where the divorced couples will not provide enough resources to their children, and it will lead to neglect and can compromise the health, which includes both the physical as well as psychological health of the children. So structural family therapy is surely supporting and majorly supporting the adolescents and the rest of the family members as well. So in this slide, we will discuss the applications of structural therapy approach. The structural therapy is more ethically and culturally appropriate, because the therapist will first develop a culturally safe bond with the client and then deliver the therapy based on the needs and preferences of the clients. This supports a more culturally appropriate therapy of the structural therapy. This approach also encourages the decision making and ethical reflection of both the therapist and the client. This approach at the same time will also target symptoms as indicated by the clients on how to solve the existing problem, which means that the therapist will first identify what is the issue among the clients and then try to resolve those issues by providing the structural therapy approach. It will resolve the parent conflict leading to child neglect. So in case if a parent ignores his son, the son will misbehave in various ways, which can lead to anxiety and stressful or agitated behavior among the children. So the therapist will first identify the agitated behavior of the child, and then will provide a structural therapy in this way, and educate the patient by providing psychoeducation to improve their overall knowledge about how neglect can harm their children. And in this way, the parents will pay more attention to the children, and the son will with the time will behave better, and the better behavior and the less agitated behavior will at the same time be identified by the therapist by taking the necessary feedback from the child. So in this way, this is a process by which structural therapy approach can be applied for the well-being of the client population. This therapy approach will also identify, explore, and evaluate The stress and limitation of the family members. The focus area of therapy include adaptability, reverberation, setting, for advancement stage. It will also keep up with the family cooperation. The therapist will first involve effective communication to understand their ideas and viewpoints and then provide a structural therapy approach for the overall learning of the family members by dissolving the interpersonal conflicts. So moving to the next slide, we'll discuss what is strategic family therapy. Till now we were discussing the structural family therapy. Now we will discuss the strategic family therapy. So this pre-strategic family therapy approach is a short-term family treatment paradigm, especially for children and teens with behavior problems. The purpose of this systemic family therapy approach is to alter the family contact patterns that enable or promote troublesome child behavior. It will also focus on cooperative and multimodal strategy, protecting child autonomy. Because child autonomy is also essential, it does not mean that the child is incompetent to make health decisions, but at the same time, the therapist must ensure that the autonomy of the child is being managed or protected by providing them enough resources to take better health decisions and also including their family members for supporting the children overall health and well-being. The socially marginalized population like Aboriginal receive more benefit from this strategic family therapy because the people belonging to the Aboriginal community are more vulnerable to drug addicts or they can also abuse alcohol, and at the same time, due to lack of education and presence of social determinants of health, the children belonging to the Aboriginal community are more vulnerable to legal actions. And in this way, the strategic family therapy will ensure a safe environment for the children belonging to the Aboriginal people. And also the children belonging to the Aboriginal community lack poor education and poor communication within the family members due to the presence of crimes and family conflicts. And therefore, this strategic family therapy will work on the whole therapy and resolve their interpersonal conflicts. So, what are the applications of strategic family therapy? We'll discuss in this slide. As we know that confrontational tactics aimed at breaking denial, reflection, and compassion. It will work on accepting the thought and ideas that a family is being impacted by interpersonal conflicts, and later on it will provide necessary resources to the family to improve their minimize their interpersonal conflicts. They will provide open questions, brief remarks, self-efficacy, and encouragement for improving the well-being of the family. This more sympathetic intervention was primarily used with alcoholics, the children who were abusing alcohol, and eventually the other healthcare professionals also gained an interest in strategic family therapy, and now this strategic family therapy is even more used by the healthcare professionals than the systemic family therapy approach. Substance dependence is described as a behavior, cognitive, and psychological symptom that describe a pathological behavior. And this substance abuse was increasing at a high rate, and there was a need to design a therapy which will include the whole family, irrespective of a single individual, and will strengthen their benefit and will strengthen the whole family approach, and by working on the behavior and the cognitive as well as the psychological symptoms. The psychoeducation can be provided as a direct intervention for increasing family structure, promoting social interactions. So we can say that the strategic family therapy will work on behavior, improving the behavior, cognition, and psychological needs of the patient, or we can say the client, and in order to make improve the well-being of the family by dissolving the interpersonal conflicts. So to conclude, we can say that the therapist must apply decision-making and ethical reflective techniques Respecting autonomy and beneficent bioethics within a therapy-based setting increases the scope of strong client-therapist relationships. It will also minimize mental health burdens, leading to improved family engagement. This contemporary therapy, including both the structural and the systematic therapy approach, will bring up new ideas and necessary actions which will benefit the family relationship. So we can say that this presentation will ensure an in-depth information about the contemporary family therapies and how this will include the whole therapy to improve their well-being by dissolving the interpersonal conflicts. These were the resources and references that were used to design this presentation. Thank you and have a nice day.